Okay. So, hi, good evening. I am Dr. Chalapathi, gastroenterologist and liver specialist. I'm working at KIMS Icon Hospital, Vishakhapatnam. Uh, so, today I'm going to talk about how to keep your liver safe. So, what are the safety tips for liver? So, this actually we have taken up the topic just to educate you because April 19th, that was last week, we celebrated the World Liver Day. So, in the wake of that, we have come out with this program to educate you all about how we can protect our liver and keep it safe. So, before going to that, we have to understand that liver can be affected or the liver can be damaged because of many reasons, out of which first cause is alcohol. So, alcohol is one of the major cause for liver problems. Liquor is a major cause. So, those who continuously drink alcohol for very long time, 5 years, 10 years, like that, and those who take large quantity of alcohol daily, including day and night, they have a lot of risk for having liver problem. Why? Because alcohol directly affects the liver, and also there will be a lot of oxidant stress on the liver, inflammation in the liver, a lot of fat in the liver, and ultimately it causes fatty liver, and then it causes elevation of liver enzymes, that is SGPT, SGOT, and then patient can have jaundice and then cirrhosis, that is end stage liver disease. So, what is safe alcohol? So, it is hardly around the alcohol limit. What is safe alcohol limit? Maybe in a week, one or three drinks. That's all. That's all. So that is a safe alcohol limit. So beyond anybody can have a risk of alcohol related liver damage. So please check yourself. Those who are drinking alcohol, please cut down your alcohol. Take counseling, visit your doctor if needed. Some medications are needed to get rid of this alcohol problem. Talk to your family, talk to your friends who are good and who can help you, so that you can get rid of this alcohol problem. So, having said that, the second most common cause is the virus, that is hepatitis B and hepatitis C virus infections. Hepatitis B is a virus infection, hepatitis C is virus infection again. So, usually the problem with viral hepatitis, that is virus causing hepatitis and liver disease, is we don't know when we caught this infection. So when this virus enters into our body, most of the times we doesn't know. But over a period of time, this damages the liver. Then patient can have jaundice, or directly they can get affected with this liver cirrhosis and viral hepatitis. So jaundice. But before having this kind of problem, because of virus B or virus C, many patients can be detected in the asymptomatic stage. Like before the liver disease happens, this hepatitis B and hepatitis C can be easily diagnosed very easily. Okay. So how to do that? It is just by testing. It's a simple blood test. If you give a small sample of blood test taken from the vein, so immediately the result comes in next half an hour or so. There are many methods like serology, like card test, antibody test. A lot of tests are there. So by doing any of these tests, we can easily find out whether somebody is detected, whether somebody is infected with hepatitis B or hepatitis C. So, so usually these infections are detected during a routine screening, like if somebody is applying for a job, so pre-employment screening we call. So, or women who get pregnant, this test is mandatory. So, Hepatitis B can be detected during pregnancy. Somebody who goes to a blood bank for blood donation, so they can actually get this test done. And somebody, if they are infected, then their blood donation will be rejected. So that is one of the most common thing where these patients are detected. And sometimes somebody is going for a procedure or a surgery or an operation. So during that time, again, these tests are run. So majority of the patients don't have symptoms, but how do they get detected? Because of this routine screening, either before a surgery or before a travel, before an employment, or during pregnancy, or just by chance during any kind of blood donation. So these patients, when they get detected, then they come to us and we evaluate them. How much is the virus in the body? What is the damage that it has already caused or it is going to cause to the liver? And depending on that, we take a decision. What category of disease is this? What stage of disease is this? What type of disease is this? And what is the best treatment available? So first important thing to get rid of this infection or to recognize easily is testing. Is you give a blood sample, test for hepatitis B and C. Okay, so in that way you can detect it very early stage and you can get it treatment also. Okay, so how does this hepatitis B and hepatitis C get transmitted? It is transmitted by 4 or 5 ways, especially in patients with who have highest behavior, like those who have multiple sexual partners, who get involved in illegal sexual practices without use of condoms or bad method of contraception. So they can get infected from their partner sexually. So please avoid these kind of behaviors, multigamous partners, avoid illegal contacts, affairs, all these things with sexual contacts and all, because they can actually make you susceptible or vulnerable to this viral hepatitis, both hepatitis B and hepatitis C. The second thing is, again, safe injection practices. Okay. So if it is safe injection practices, we have to see that we don't share the needles. Like, for example, somebody has some fever or pain, they can go into a village and get it tested, get the injections. So please confirm that it is a disposable needle and a single-use needle, so that your local doctor or nurse or a compounder is not actually using a reusable needle. Okay, so otherwise it's infected. If it is infected with some hepatitis B and C, if they use the same needle, it is going to infect you also. Okay, so please be careful whenever you take any injections. Be sure that it is a sterile and a new one which is open from a pack. Okay, so the other thing is, again, sharing razors or blades in your salons. So be sure that it is not used for anybody before. It's a fresh one and a sterile one. Okay, so that is another thing. So and the other thing is about blood transfusions. So whenever you receive any blood, so be sure on the packet that it should be a label. It is tested and negative for hepatitis B and C. So all these things are very important. You be careful when you're receiving any blood. You be careful when you are taking any injections. You be careful when you are visiting a salon. And also, sometimes in pregnant women, actually, the infection can be prevented. And for the newborn baby, if proper treatment and vaccines and immunoglobulin are given to the mother and the baby, then the infection cannot be transmitted. Okay. The third most important thing to prevent viral hepatitis, especially for hepatitis B, is vaccine. So if you take a vaccine now, because of even a universal immunization program, now vaccines are available freely and easily. So especially kids, after their birth, usually get doses, 3 doses to 4 doses of hepatitis B vaccine. Even for adults who don't know their vaccine status, who didn't get their vaccine for hepatitis B, then please take this hepatitis B vaccine 3 doses. One in zero, that is index dose, that is the first dose. After 1 month, another dose, and after 6 months, the third dose. So 3 doses has to be taken. That gives complete protection. And every 5 years, a booster has to be taken. So this completes to the prevention of viral hepatitis, which is one of the important cause for liver problems. So we have discussed about alcohol. What are the safe alcohol practices? How to cut down alcohol? The second thing is viral hepatitis. You test it frequently for hepatitis B or hepatitis C. That is one of the major things where you can prevent the infection or prevent the future liver damage. In viral hepatitis, again, what are the best practices? You should avoid high risk behavior and all, and give vaccine for hepatitis B. Now, having discussed about alcohol and hepatitis, now the third most important cause, now it is picking up, that is fatty liver. So fatty liver is actually one of the leading causes. Okay, so wherever you get an ultrasound for some other reason, okay, for any reason, like you have a stomach pain, you have some abdominal like stomach bloating, indigestion, some female related issues, some menstrual cycle issues, some kind of bowel disturbance. You get routinely some ultrasound if your doctor has prescribed. Then sometimes this ultrasound shows fatty liver, grade 1 fatty liver, grade 2 fatty liver, grade 3 fatty liver, like that. Okay, and along with that, sometimes the liver can also be enlarged. Okay, so there is enlargement of liver, there is fatty liver. Okay, so what are the frequent causes? The two or three most important causes for fatty liver are diabetes, number one cause. Okay, diabetic patients can have fatty liver very frequently. Okay, the second most common cause is obesity. So diabetes and obesity are very frequent causes. So the third important cause is lack of physical activity and very poor diet habits. Like the people will eat a lot of junk foods, lot of processed food, westernized diet, like that. So they will have trouble because of the internal metabolism is changed, internal insulin system is changed, internal glucose metabolism is changed, internal fat metabolism is changed. It is constantly under inflammation and stress. So this causes hormone changes, chemical changes, and enzyme changes inside, and it causes inflammation, it causes stress upon the liver, and it causes fatty liver. Okay, so depending on the grade and all, so fatty liver grades are there. Now, in a better way, we actually do fibroscan. So we have fibroscan wherein we have the levels of fatty liver. Okay, so the cap score is there, attenuation parameters we take, and the scoring systems we give. And when we start treatment for fatty liver, then again repeat this fibroscan every 6 months or so and see how this fatty liver is reducing. Okay, so in that way we can actually detect how much fat is there in the liver. Along with that, if fat is causing some kind of inflammation in the liver, then also we can have some assessment by kilopascals. The liver gets stiff, so we assess the liver stiffness, that is called fibroscan. We can assess the fat also, we can assess the uh, fibrosis, that is stiffness also in the liver. Okay, so so three important causes for fatty liver: one is diabetes, second is obesity, third is lack of physical activity and poor diet habits. So physical activity, again, what do you do? How do you prevent? So how do you improve your liver in these patients? How do you prevent this? What are the things? So as we know, prevention is better than cure. If somebody is having dangerous eating habits like binge eating, lot of sudden eating of food, okay, lot of consumption of western diet, please avoid it. Include lot of vegetables in your diet, include lot of fruits in your diet. Avoid all high carbohydrate stuff like potatoes, processed food, white bread, um, high fatty contents. Okay, so all this stuff. So avoid all kind of junk food and all. So that will help you actually reduce the calories that you take, and you're going to consume the right kind of calories. Okay, so go more with protein based diet, that will help you a lot. Okay, and along with that, you need to actually do some kind of physical activity. So the recommended is around maybe 150 minutes every week, 150 minutes of moderate kind of exercise sporting like jogging or brisk walking or some kind of cycling like that. Aerobic exercises will help you, and that will actually improve your insulin resistance. Your insulin becomes more sensitive, and your fat in the belly, especially in the tummy, will reduce. Your visceral fat will come down, your weight will come down with both diet as well as exercise modifications. Okay, so this is very important because right now we are in a pandemic of COVID. It is ending, but we have a bigger pandemic happening in last 1 decade, that is unhealthy eating habits, uh, lack of physical activity. So these two are very, very dangerous things, which is causing more and more amount of fatty liver in the community. Okay, so those who have fatty liver, we actually do a liver function test. We do fibroscan. We do rule out hepatitis B and hepatitis C infections. We look for other problems like patient having high cholesterol, patient having high blood pressure, patient having obesity, patient having high sugars. All these things come into metabolic syndrome. So patients having metabolic syndrome, they have high BP or high cholesterol, high triglycerides, high sugars, high body mass index, heavy weight, all these things. So the best way is to do weight reduction by diet modifications and exercises. Okay, uh, home remedies, you can take you can avoid all kind of junk food at home. You can stop cooking junk food at home. You avoid all kind of heavy calorie stuff. You can take brown rice, brown bread. You can take a lot of uh, uh, animal protein. You can take a lot of vegetable protein. Cut down on your carbohydrates. I think that's the best way to do it. Okay, you can use any kind of oil. I'm not recommending anything, but don't use any reheated or processed fat or processed oil like that. Okay, whatever you take, reduce the content of carbohydrate or fat in your diet. That's all. So again, diabetes, as we have discussed, diabetes has to be controlled regularly with again diet and medications, exercise, etc. Talk to your liver specialist, talk to your diabetes specialist, get a fibroscan done, get an ultrasound done, because patients who have fatty liver in diabetes, they have high risk of heart problems also. So those who have fatty liver with diabetes, they are at more risk for heart problems. Okay, so in that way, you can also detect heart problems at a very early stage. Okay, so that's all for today. Um, First thing we have discussed about alcohol. So please be careful. Safe alcohol practices. Don't over binge. Don't excessively drink alcohol. Cut down your alcohol. Second thing is frequently get tested for hepatitis B and C time and again. Get vaccination for hepatitis B, especially. Safe practices, especially be careful when you're getting a blood transfusion or any kind of surgery or any infection when you're going to a salon. Please be careful. The third thing is diet and lifestyle. So cut down your carbohydrates, exercise more, and I think you can protect your liver. More importantly, now there is some data that if you drink coffee, obviously, I mean, with the low sugar, it maybe 1 or 2 cups a day, it might protect your liver. Okay, so coffee has good antioxidant properties, and probably that might help you. Okay, that is something I'm going to suggest you. Okay, so that's all for today, and thank you all for listening to me. And if you have any questions, please write it down. Okay, in this comment section in this Facebook Live. Thank you so much. So I am Dr. Chalapathi, gastroenterologist, KIMS Icon Hospital from Visakhapatnam. I'm signing off. Thank you.